When a new patient attends for dental treatment, the patient will be asked to provide important information about themselves by filling out a medical history form. The information collected on this form has a couple of purposes. The form collects information to identify a patient, which will be used to create their patient record. This record will then be used for all future appointments, filing of referrals and treatment plans. The form also alerts the practitioner to any potential risks for the patient that may affect treatment decisions. Risks can include past and present medical treatment and illnesses, medication allergies, and any potential adverse drug interactions, and whether transmission-based precautions need to be considered for that patient. All information collected is for the purpose of providing dental services to that patient. It is essential this information remains confidential. In some instances, patients may need support to understand or answer the questions on the form. To ensure the form is accurate and concise, the oral health practitioner can assist the patient in private. It is likely all members of the practice team will have some access to patients' information and their clinical records. If you have access to this information, you have a professional and legal obligation to protect the privacy and confidentiality of this information. Dental practices are required to have a privacy policy which patients can access. You should familiarise yourself with this document and ensure you are meeting the expectations set out in the policy. Some practical tips to protect privacy in the dental setting are: treat all patient information as confidential. It is important to ensure that paper records are not left open in areas where they may be seen, and digital records that identify a patient are not left up on the screen for others to see. Ensure that conversations with patients about sensitive personal and health information take place in a private setting. Only view private patient information when you need it. It is not appropriate to look into the details of people you know or go through files out of interest. Only access the private information you need to know to be able to perform your duties effectively. Once patients provide their private information, make sure this is not inappropriately distributed. This means that special precautions should be taken with letters or emails containing private information, and documents should be shredded before being discarded. Avoid using the patient's name whenever they are not present. Although it can be useful to speak about cases with colleagues to develop your skills, it is important not to disclose the particular patient you may be speaking about without their explicit consent. It is never appropriate to gossip about people you have seen during the work day. For more information about topics covered in this video, please contact ADA New South Wales Practice Services. ADA New South Wales has produced this series of videos as a guide only and is not a substitute for site-specific training and education. All dental practices should develop their own policies and procedures and conduct appropriate training that is relevant to their setting and consult relevant guidelines and standards to ensure compliance if required.